The gastric balloon was developed as a temporary aid in the treatment of obesity. This technique helps reduce the stomach's capacity by up to 70%, creating an early sensation of fullness with smaller amounts of food. This assists patients in adhering to a low-calorie diet, which involves reducing food quantity and improving its quality. When combined with physical activity and the support of a multidisciplinary team, psychologist, nutritionist, psychiatrist, sports medicine specialist, the chances of success in treatment increase and the long-term control of weight becomes more sustainable. This treatment is primarily recommended for patients with overweight or mild obesity, BMI between 25 to 30 for overweight and BMI 30 to 35 for mild obesity. In terms of excess weight, this means that the gastric balloon is generally indicated for patients who need to lose between 8 kilograms and 30 kilograms. The gastric balloon also has a second, very important use for patients with moderate to severe obesity, BMI over 35, who may qualify for bariatric surgery but either do not wish to undergo surgery or have a contraindication for it. For these patients, the gastric balloon can serve as a helpful tool for weight loss. This group is an important part of the experience at the obesity group of Clínica Medellín. The process of placing the gastric balloon always begins with a diagnostic endoscopy to ensure that the patient has no conditions that would contraindicate the procedure, such as gastric or duodenal ulcers, esophageal or gastric varices, suspicious lesions, large hiatal hernias, gastric deformities, or severe inflammation like esophagitis or gastritis. Performing this procedure without a prior endoscopy could increase the risk of complications, which is why this step is critical for patient safety. The balloon is inserted through the mouth into the stomach while deflated, under direct endoscopic vision. This ensures that the entire procedure is performed under strict control. Once inside the stomach, the balloon is filled with sterile saline between 500 to 600 cubic centimeters, again under endoscopic guidance to confirm that the balloon is in the correct location. Other methods, although reliable, do not offer the same level of certainty as direct endoscopic vision and may lead to complications such as filling the balloon in the esophagus. Once the balloon is filled, it is detached from the catheter, and under direct endoscopic vision, we can ensure that the valve is fully sealed without leaks and that the balloon is correctly positioned in the stomach. The entire procedure is done under deep sedation, supervised by an anesthesiologist, without the need for intubation. It typically takes about 10 minutes, with a quick recovery and no need for hospitalization. The removal of the gastric balloon is also done through endoscopy, under deep sedation, and in an outpatient setting. This procedure involves deflating the balloon with a needle and then extracting it using a specialized tool. Once removed, the patient can resume normal activities without the need for special medication or care. It is essential to remove the balloon after the treatment period, 6 months to 1 year, to prevent complications such as intestinal obstruction or perforation, which could occur if the balloon were to pass through the digestive tract, requiring surgical intervention.